Relief tonight. Thank you so much, Gary. Well, when it's this hot, you hear a lot about heat stroke, and heat stroke is when your body actually fails to maintain a normal temperature, and it can cause some serious things like seizures, even brain and liver damage. We went and spoke with Dr. Stephen Thornton over at the University of Kansas Hospital today. He has treated a few patients for this condition. He says some of the symptoms to watch for are a rash, cramping, and then dehydration. And get this, most of those symptoms, he says, can appear at all different types of times for different people.
Interestingly, there's really no time limit, that nobody's come out and said, well, you can be out in this heat for 15 minutes or anything like that. It's really dependent on how well you're adapted to the heat and how much you've been drinking. But I would say if you start to feel any cramps, if you start to feel dizzy, you should probably take a break and go hydrate, cool off, get in the shade, get in some air conditioning.
Good tips there. Now, those most affected by heat stroke are children and the elderly. Dr. Thornton recommends checking on them as frequently as you possibly can.